I've been treating depression since 1989 when I graduated from medical school, so professionally since '89, but personally since my teen years struggling with my own depression. Two of the most painful aspects of what somebody suffering with depression has is just the distorted sense of what's going on. Their lenses are so distorted with that dark, depressive cloud that's around them. It's just hard for them to see anything clearly at all. And then the other real painful aspect is that everything is just so much harder. There's no hope, there's no peace, and it doesn't seem like there's any answers or any way out of the depressive episode that they're in. On a day-to-day basis, a depressed person experiences several things that are very difficult. First, it's this dark cloud, like Pigpen in Peanuts. A depressed person has this dark storm cloud that's around their head. It makes it difficult for them to see anything clearly. Everything has this sort of doom or gloom appearance or feel to it. With that distorted view, they feel just real alone. It feels like they don't have any allies, any supports, that they're doing life in isolation or all by themselves. Another aspect they feel is just incompetent. They feel like a failure, like everything they touch sort of rots or is ruined. Nothing they can do is right, whether it's with their kids, whether it's with a spouse, what they do at work. Everything is contaminated or feels like a failure. When you see things this way and you're feeling that way, everything is just a lot harder. So life, even just getting up in the morning, eating a meal, just doing basic chores seems just so much more difficult, takes a lot more energy, it's just so tiring and exhausting. Probably the biggest struggle that people experience is emotions start to rule who you are. They start to be your reality. And that's such a dangerous thing. Our emotions are a great warning system, but a terrible reality system. They're not reality. But it's easy to start to feel alone, incompetent, scared, and feel like nothing is going for you when you have this dark cloud around your head. So then you have this overwhelming sense of pain that you just carry, and it becomes a burden, and it becomes so tiring. So they get this battle fatigue of constantly carrying this pain with them through the day. And those are some of the things that somebody with depression experiences on pretty much a day-to-day, almost moment-by-moment part of their day. Clinical depression is a term that we commonly hear. In psychiatry, we really don't have an actual diagnosis of clinical depression. What we call it is major depression. So major depression is a constellation of symptoms where a person feels depressed or a lack of interest in pleasurable things or in life for at least a 2-week period. And then they have to have 4 of these other 7 symptoms. One of those symptoms is decreased appetite or increased appetite. Another is changes in sleep pattern, either not needing to sleep or sleeping way too much. A person could feel either agitated or very slowed down and lethargic. Another symptom is lack of energy. Then there can be cognitive issues as far as difficulty with decisions, being indecisive, having problems with concentration and focus. Then there's an element of feeling of worthlessness, helplessness, and hopelessness. And the most serious symptom is thoughts of death or actual suicidal thoughts or suicide attempts. So if they have those constellation of symptoms, and for more than a 2-week period, we call that major depression, as long as they're not caused by a medication, a medical illness, or drug and alcohol abuse. So sometimes those things can cause these kind of same symptoms, but need a whole different treatment than what we do for major depression. The other thing is these symptoms have to interfere with your functioning and cause significant distress. If those kind of things are happening, we call that major depression. It's very treatable. There's a lot of hope, but the person needs to get to the professionals so that we can do a good assessment, make sure there isn't anything medical, medication, or substance abuse going on, and then institute the right talk therapy, spiritual discussions, as well as medications if necessary.